I'm Dr. Kate Heimann, and I practice family medicine and full spectrum OB here at Adams Hospital. I like being a family medicine doctor that practices OB for the last 13 years almost, because I get to see families grow up. I grew up in a small town. I enjoy the community sense of practicing medicine. I enjoy seeing my patients at basketball games, and I enjoy seeing them at show choir events and being able to follow families from babies to grandparents. And I get the most reward when I get to see that throughout the day, start to finish. I think what gets me up in the morning to come and do this is being a part of families. And I think that's what gets me from not just seeing a patient to patient, but seeing friends and seeing kids that I've been able to be a part of at delivery and watch them grow up. So it's not just a job. I tell my kids that I'm so blessed that I get to do this and it doesn't feel like a job. I chose Adams because when coming out of residency, I was doing ER work, I was doing labor and delivery, and the perfect fit was here in this community where family medicine has been a foundation to supporting our hospital, to supporting our community. And I was well received and welcomed to continue to do that. And I felt that being able to see families through all those environments was a benefit that I couldn't do anywhere else, not just for me personally, but for families. And to know, being sick in stat care and then being able to see you later in the week for something else, and having that knowledge and being able to see the whole picture. I chose family medicine because I enjoy taking care of babies to grandparents. I enjoy all of the triumphs and struggles in between. I enjoy making the connections between parenting and raising kids to taking care of your parents and the struggles that come with that. And then I also enjoy just the variety. It's extremely rewarding to take care of a sore throat, but then to also deliver a baby and see how that's helpful to my patients as well, just being a part of from start to finish. I see some of the rewards in family medicine of treating kids, their parents, the whole family, just kind of day to day, and seeing them in activities, seeing them at school functions, sporting events, and making that connection of, yeah, I did see you play basketball, and I did see how great you were at the show, and different things that then make it a very real connection to that adolescent or to that child, and makes them, at least while they're in my office, that I really care and I really enjoy seeing them grow up. I think a unique trait of most of our family physicians here in the area is that we're very well-rounded. We've intentionally sought out experiences that keep us up to date on the whole spectrum. And family medicine can be a very broad spectrum of patient care. So, you're not going to have someone that's unfamiliar with pediatrics, unfamiliar with prenatal care, unfamiliar with surgical, consequences and recovery. So I think that we are unique, that we're not just one specialty family medicine. So one of my areas of enjoyment is taking care of athletes and student athletes, and growing up athlete myself. And so staying connected how I can in family medicine via concussion management. Unfortunately, concussions were not well diagnosed and treated and followed in the past, and we've seen lots of media on that. And having the opportunity in training to get more certification and experience with that, I felt like that was something that this community could benefit from. And here locally, we unfortunately have concussions like anywhere else, but fortunately I think we have a great system in place that will protect our student athletes more so than we've had in the past. I see that athletes who are usually very competitive both in the classroom and in the sports arena often will put themselves in a very vulnerable situation that sacrificing their recovery for, I need to get back on the court or on the field, I need to maintain my 4.0 GPA, and so I have the opportunity to help protect those athletes, whereas I don't feel like that was, 20 years ago we were able to do that for our athletes. So I'm hopeful that moving forward we'll continue to be a safety net for our athletes in the area. I receive the most joy from, I have to say, delivering babies. I just love that victory for that family of just welcoming that new member to their family. It's just a kind of a speechless moment that I'm so honored to be a part of, and my job is to make it a safe one. And so when you have that safe mom and safe baby, it's just an incredible moment.